Hi there, my name is Dr. Ngozi and welcome to my channel. And today I'm going to be talking to you about a very important topic because if you're a traveler or if you're located in an area that has cholera outbreak, this is information that you need to know. And I provide health education content, and that's what this is, just health education content. So I'm just going to give you some pointers about cholera, how to prevent it, and how to tackle it if you or someone you know contracts cholera. So, what you should know. Uh, the scary thing about cholera, it can kill a person within a few hours. So, cholera is spread when feces that's contaminated with this terrible bacteria called Vibrio cholera gets into the water supply, and somehow that water supply gets into your food intake or your drinking water. So, cholera can present either as a mild illness or a severe illness. And if it's mild, it can cause nausea, vomiting, diarrhea. The diarrhea that's quite unique to cholera is described as a rice water stool. So it looks like the kind of water you get after you've rinsed rice. So now the issue with this condition is that uh, it can be quite a horrible infection. So it causes a secretory diarrhea, and that's caused by the toxin produced by this bacteria called Vibrio cholera. It's not a nice infection to have because it can make people really sick, and if untreated, it can cause death. So, I mentioned the symptoms of mild cholera, nausea, vomiting, diarrhea. It could also present with severe cholera, which is just this rapid onset, massive, watery diarrhea. And this kind of massive, watery diarrhea can just cause rapid dehydration and shock, and the person can slump just within a few hours. So it's very important to understand what this infection is and how serious it is and take it seriously. So, complications of cholera include electrolyte imbalances. So, from this diarrhea, all kinds of imbalances can occur, and this can lead to cardiac complications, stroke, renal failure. In women who are pregnant, it can lead to miscarriage. It can also lead to pneumonia because of the vomiting. The vomit can go down the wrong airway, so go down the lungs and cause infection. So, if cholera is treated fast, 99% of people will survive. So, the key to surviving a cholera infection is prompt hydration and treatment. So, there's really no time to waste with this disease. And if you have cholera, the best thing, if you can, is to prepare a solution of oral rehydration solution. It's called oral rehydration solution, and start drinking it, and then get to the hospital ASAP. So with hydration, 99% of people survive. So if you have signs or symptoms of cholera, nausea, vomiting, diarrhea, begin hydration with the oral rehydration solution and get to your nearest hospital for intravenous hydration or drip and antibiotics. So, how to prepare oral rehydration solution? You can either buy the sachet already pre-mixed with electrolytes and add it to water. If you don't have that, then you have to mix from scratch. So you want 1 liter of clean water, preferably boiled water that has been cooled down, or bottled water from a reliable source. And then you add to that 6 level teaspoons of sugar and half level teaspoon of salt. Mix well and drink it down. Avoid juice, during diarrhea because it can make the diarrhea worse. So, to prevent cholera, generally, drink safe and clean drinking water. Ensure your food is well cooked. Avoid eating raw foods. Wash fruits with clean water. Peel your fruits. Wash your hands with soap and clean water or use alcohol sanitizer for hand hygiene. So, in the United States, there is a vaccine available for people who are traveling to areas where cholera is present. And this vaccine is given 10 days before travel. So, if you have the opportunity to get the vaccine and you're going to an area that has a cholera outbreak, you want to talk to your medical provider to make sure you can get this vaccine. So, if you're planning travel to an area with a cholera outbreak, purchase sachets of ORS before you travel. So, you can buy it from the pharmacy, CVS, Walgreens, Rite Aid, Walmart, and it's sold as Pedialyte. So you can buy that and it's easy to mix in with water. You can carry those sachets with you. Now, when you're traveling to foreign countries, I usually ask people to try to find out where the hospitals are around you in case you need care. And also be mindful that not a lot of hospitals overseas will accept your health insurance. So if you're having a medical emergency, cash is king. So always make sure you have some cash to pay for at least the initial hospital admission because some places may not take your credit cards and they may not take your health insurance. So that's all for now. Thank you so much for listening. If you've enjoyed listening to this video, you found it helpful, it is health education, please subscribe to the channel and definitely share this information with your friends. Thank you and have a wonderful day.